Biggest challenge for a doctor is that to make him aware that he has to take the medication for next 6 months. Khansi hai, and then fever, weight loss, and loss of appetite. That is the basic symptoms that we have seen. It's impossible. 25 is too near for us. Even I think the modest target should be 35.
नमस्कार, मैं हूं प्रवीण। आज 24 मार्च है, वर्ल्ड टीबी डे। वर्ष 1882 में आज ही के दिन एक जर्मन फिजिशियन ने टीबी के जीवाणु की खोज की थी और तब से लेकर आज तक हर साल वर्ल्ड टीबी डे मनाया जाता है। हालांकि इसका इलाज आ गया है, लेकिन फिर भी कितनी जागरूकता की ज़रूरत है ये समझने के लिए आज हम पहुंचे हैं पालम में स्थित दिव्य प्लस हॉस्पिटल में। और मेरे साथ मौजूद हैं हॉस्पिटल के एमडी डॉक्टर ज्ञान वत्स। डॉक्टर साहब, आप अक्सर गंभीर विषयों पर अपनी राय रखते हैं। टीबी का इलाज तो आ चुका है, इंडिया में टारगेट रखा गया है कि 2025 तक भारत टीबी मुक्त भारत होगा, लेकिन अब भी कितनी ज़रूरत है जागरूकता की दूर दराज के गाँवों में, रूरल एरियाज़ में?
2025 was an over-ambitious target and unattainable target. It's impossible. Reasons is so many. एक तो पहली बात ये है, this disorder, बीमारी is associated with so many myths, and second thing is this कि diagnosis में पहुंचना is a big challenge. कितने percentage of population हमारी है, they're roaming with tuberculosis, and he attends a doctor clinics. It takes 10 visits to a doctor to get a diagnosis of tuberculosis. So it's a very big challenge. And despite so many advances that we have made using RT-PCR methods and other methods and new medications that come, but tuberculosis as a burden, as a problem, is always one step ahead than us.
डॉक्टर साहब, टीबी के क्या कुछ लक्षण हैं और कैसे पता चलता है कि इंसान को टीबी है, अब डॉक्टर से कंसल्ट करना चाहिए?
देखो, टीबी के लक्षण तो वही हैं जो पहले थे। अब प्रॉब्लम इज नॉट द साइन एंड सिम्टम्स। खांसी है, एंड देन फीवर, वेट लॉस, एंड लॉस ऑफ एपेटाइट. दैट इज द बेसिक सिम्टम्स दैट वी हैव सीन. बट द थिंग इज, आफ्टर द emergence of this factors called as low immunity, तो उससे ना एक्स्ट्रा पल्मोनरी ट्यूबरकुलोसिस के स्कोप बढ़ गए हैं. आफ्टर द स्प्रेड ऑफ HIVs एंड अदर इम्यूनोकॉम्प्रोमाइज्ड डिजीज, तो ट्यूबरकुलोसिस के मैनिफेस्टेशंस एंड ट्यूबरकुलोसिस के सिम्टम्स हैव बिकम वेरी चैलेंजिंग. एंड जैसे आजकल आफ्टर दिस पोस्ट ट्रांसप्लांटेशंस, यूज ऑफ मैसिव immunosuppressants, so you have patients are getting tuberculosis despite any symptoms, and very difficult to pick up those patients of CKD on dialysis. They are harboring tuberculosis, but it's very difficult to pick up. So it's not, you cannot say pinpoint that this few symptoms are there through which we can pick up tuberculosis. This is the biggest challenge. Diagnosing tuberculosis is the biggest challenge for any physician or doctor, because the manifestations are vast and countless.
आपने बताया कि एक फिजिशियन के लिए या डॉक्टर के लिए बहुत चैलेंजिंग है। क्या ऐसा भी होता है कि एक पेशेंट का इलाज जब चल रहा होता है तो पेशेंट नाराज़ हो जाए या फिर कुछ हो जाए ऐसा उल्टा सीधा, और डॉक्टर के ऊपर लोग चढ़ जाएं, हॉस्पिटल में हंगामा करने लगे? ये भी एक पार्ट है इसका।
देखो, फर्स्ट ऑफ ऑल इससे हैविंग ए सोशल स्टिग्मा अटैच्ड. तो इफ़ यू लेबल समबडी एज ए पेशेंट ऑफ ट्यूबरकुलोसिस, इट टेक्स लॉट ऑफ एक्सपीरियंस टू काउंसिल द पेशेंट एंड मेक हिम एक्सेप्ट कि आपको ट्यूबरकुलोसिस हो गई है. फिर सेकेंड बिगेस्ट चैलेंज फॉर ए डॉक्टर इज़ दैट टू make him aware that he has to take the medication for next 6 months without fail. The biggest challenge for us, the compliance. That's where our government has failed earlier, and even now this is the biggest challenge. And drug compliance, patient compliance, has resulted us today. Now we are challenging a bigger problem than tuberculosis is known as MDR tuberculosis, multiple drug resistant tuberculosis, because of poor compliance from our patient sides. So I don't blame the patients. It's a it's a social program, and it needs integration from multiple sectors. You just can't have a doctor that it's his responsibility that you should ask the patient to take the medication for complete 6 months. I think the social workers, governments, everyone has to take a big role in this part.
As you discuss about the compliance issues, so do you think that government should also make some laws in favor of the doctors as well? Because बहुत सारे पेशेंट ऐसे हैं जो देखा गया है हॉस्पिटल में तोड़ फोड़ भी करते हैं, नॉट ओनली टॉकिंग अबाउट ट्यूबरक्लोसिस बट किसी भी प्रॉब्लम के लिए सर्जरी में कुछ गलती हो जाए तो परिवार हॉस्पिटल पे चढ़ जाता है, तोड़ फोड़ करता है. तो ऐसे में क्या लगता है कि डॉक्टर की सेफ्टी के लिए प्रशासन को, सरकारों को कोई लॉ बनाना चाहिए सर?
Definitely, I think if doctor doesn't have confidence or he's always worried about his own personal security, I can give you in writing and guarantee you that he will not give his 100%. If you want a transparent treatment, then at least first thing a doctor needs is his security.
Yes.
And after all, you have to realize we are dealing with human lives. And 100% success no one can give. And definitely human errors can take place. But if this some patients has some grudges, he should approach the court of law. But he can't. He doesn't have the right to create ruckus or violence. I think it's a big shame, and I think a matter of serious concern. And I think they should have proper laws that should protect our rights.
Great. Dr. Gyan, as we are talking on World Tuberculosis Day, we talked about the symptoms and TB. If we talk about the treatments, what are the treatments available in healthcare? What are the treatments available for the TB?
Though I think Modi government has declared that India should be tuberculosis free by 2025, and for that, I think this government has really done a wonderful job in enacting so many programs. Most of the centers, governments, hospitals are having treatment of tuberculosis, which is free of cost. And luckily now, good news for patients suffering from MDR. The patency right over those expensive medications for MDR, betaquilin specifically, is about to get over. So even the treatment of MDR is going to get very, very cheap, and it's going to benefit millions of patients across India and abroad as well. And I think the cost should not be a worry factor for tuberculosis, because every center across India is giving you the medication free of cost along with counseling. And with this fixed dose compliance is coming. So it's easy to take also. I think price has not going to be a big issue, at least in India.
डॉक्टर साहब, जो भी लोग आपको देख रहे हैं, हो सकता है उनमें कुछ पेशेंट भी हों, तो उन लोगों को आप क्या कहना चाहेंगे जो लंबी बीमारी से जूझ रहे हैं, और क्या वो करें, क्या कुछ खान पान रखें, कैसे कंट्रोल करें इस प्रॉब्लम को?
See, if you look at the risk factors of tuberculosis, it is poor immunity, and India is still suffering from malnutrition. So if we really want to eradicate tuberculosis, it's not the only that therapeutic part that you take care of. Prevention part has to be taken care of. Vaccinations plus a very good nutrition programs for our children need to be taken care of.
In the beginning, you said that it's really difficult to make India tuberculosis free till 2025. Do you think it will not be possible, right?
It's impossible. 25 is too near for us. Even I think modest target should be 35, because the biggest challenge so far in India is still, we are harboring 1/4 of the tuberculosis burden of the world, and every year I think 3 million new cases are getting detected. And when you think 3 million are getting detected, imagine the number of patients which are roaming without getting detected. and until unless there is a the government involves the private sector with complete fairness, this program is, I think, is not able, government can't achieve this program without the help of private practitioners. So I think the role of private agencies need to be also embodied.
क्या कुछ पेशेंट को भी कंट्रीब्यूट करना चाहिए, देश की जनता को भी कंट्रीब्यूट करना चाहिए कि जल्द से जल्द जो है इसको ख़त्म किया जा सके?
Education and compliances, this is two important thing. So awareness about this tuberculosis, that this can happen to anybody, and there is a cure for this everyone should realize, and to really, and once when you get diagnosed, taking proper treatment with complete course, that should be responsibility.
थैंक यू वेरी मच फॉर योर प्रीशियस टाइम.
Thank you very much.
तो ये थे मेरे साथ डॉक्टर ज्ञान, जिन्होंने टीबी के ऊपर हमसे बातचीत की, और उम्मीद करते हैं कि ये इंटरव्यू आपके काफ़ी काम आने वाला है और काफ़ी कुछ समझने को और सीखने को आपको मिलेगा. कैमरा जर्नलिस्ट प्रशांत के साथ प्रवीण, इंडिया टाइम 24 न्यूज़.
खबरों से खबरदार रहने के लिए चैनल को सब्सक्राइब करें और प्रेस करें बेल आइकन.